women's heart disease risk could be predicted up to 30 years. Hello everyone, welcome back to our channel. Today we're focusing on an essential topic, predicting heart disease risk in women, but particularly in the United States. We'll explore why this is so important and what steps you can take to understand and manage your risk. Let's dive in. The leading cause of death in the United States for women is heart disease. About 1 in 3 women will pass away from heart disease, according to the American Heart Association. This statistic emphasizes the significance of knowing our risk and is more than simply a number because it represents actual lives. Heart disease frequently manifests in women in the United States in a different way than it does in males. Atypical symptoms can be more common in women, which can complicate diagnosis. For instance, although chest discomfort is a typical symptom, women may also feel tired, queasy, and short of. When there is a significant reduction or obstruction in the blood supply to the heart, a heart attack happens. The accumulation of fat, cholesterol, and other materials in the heart's coronary arteries is typically the cause of the obstruction. The deposits that are high in fat and cholesterol are referred to as plaques. Atherosclerosis is the term for the plaque accumulation process. Plaque may occasionally burst and create a clot that stops blood flow. A portion of the heart muscle may get harmed or destroyed by inadequate blood flow. Heart attack. An artery that supplies the heart with blood and oxygen becomes clogged, which leads to a heart attack. Over time, deposits of fat and cholesterol accumulate in the heart's arteries to create plaques. Most heart attacks are caused by coronary artery disease. One or more of the heart's coronary arteries are clogged in coronary artery disease. Plaques, which are deposits made of cholesterol, are typically to blame for this. Blood flow to the heart can be decreased by plaques that restrict the arteries. A blood clot in the heart may result from a plaque break. A heart coronary artery blockage, either partial or total, can result in a heart attack. Whether an electrocardiogram ECG or EKG reveals any particular abnormalities, saint elevation, that call for immediate invasive treatment is one approach to categorize heart attacks. These heart attack kinds may be described by your healthcare professional based on the results of an electrocardiogram ECG. Let's examine the heart disease risk factors that affect American women. Women have specific risk factors in addition to some that are similar to those for men. These are the principal ones. 1. Age risk rises with advancing years, particularly following menopause. 2. Family history. There is an increased risk if heart disease runs in the family. 3. Lifestyle factors. Not exercising, eating poorly, and smoking are major causes. 4. Health conditions. Diabetes, high cholesterol, and high blood pressure are important variables. 5. Hormonal factors. Heart health can also be impacted by disorders including polycystic ovarian syndrome, PCOS, and difficulties from pregnancy. In the US, heart disease is the top cause of death for women. About 1 in 3 women will pass away from heart disease, according to the American Heart Association. This statistic emphasizes the significance of knowing our risk and is more than simply a number because it represents actual lives in the US. Lifestyle choices play a huge role in heart disease risk. For instance, the prevalence of obesity and sedentary lifestyles contributes to high rates of heart disease. However, making positive changes can significantly reduce your risk. Here are some heart-healthy recommendations suited for American lives to help battle these risk factors. 1. Consume a well-balanced diet, emphasizing whole grains, fruits, vegetables, and lean meats. Because processed foods are heavy in unhealthy fats and sodium, you might want to cut back on your intake. 2. Get regular exercise. Try to get in at least 150 minutes a week of moderate activity. Exercises like swimming, cycling, and brisk walking are great choices. 3. Give up smoking. If you smoke, get help to stop. One of the main risk factors for heart disease is smoking. 3. Limit alcohol. Women should only have 1 drink every day or moderate alcohol consumption. Although implementing these modifications may seem difficult, keep in mind that every little step counts toward improved heart health. We have renowned cardiologist Dr. Smith to help us understand more about estimating the risk of heart diseases in women, particularly in the United States. What cutting-edge techniques are employed to estimate the risk of heart disease, Dr. Smith? Dr. Smith, excellent query. In the United States, we estimate women's risk of heart disease using a variety of risk assessment instruments. One such metric is the Framingham Risk Score, which considers variables like age, smoking status, blood pressure, and cholesterol levels. Furthermore, more recent approaches are using sophisticated imaging tools and genetic data to deliver a more individualized risk assessment that is very educational. Are there any particular heart health criteria that women in the United States should adhere to? Doctor, Smith, the American Heart Association, does offer a number of recommendations for women, such as routine cholesterol and blood pressure checks, preserving a healthy weight, and stress management. Talking to your healthcare professional about any symptoms or concerns is also very important, especially if you have a family history of heart disease. So if you're worried about your chance of developing heart disease, what actions should you take? Make an appointment to see your doctor first. They are able to assess your own risk and make customized recommendations for tests or lifestyle adjustments. The following are some immediate actions you can take. 1. Make an appointment to see your physician. 2. Take a cholesterol and blood pressure test. 3. Talk about any risk factors and your family history. 4. Adopt heart healthy dietary and physical activity habits. You can lower your risk and enhance your general heart health by being proactive. By screening for 3 risk markers with a single blood test, it may be possible to predict a woman's future risk of developing heart disease. This is supported by research that was presented at this weekend's European Society of Cardiology ESC Congress and published in the New England Journal of Medicine on Saturday. The study, which comprised over 30,000 women with an average age of 55, used a blood test in 1993 to evaluate 2 different forms of fat and 1 specific type of protein in the circulation. The participants' health was then followed up on for a 30-year period, the researchers added. Doctors state that one crucial red flag that is frequently overlooked when assessing the risk of heart attack is that the greatest predictor of risk was a basic blood measure of inflammation known as lipoprotein A, cholesterol. And high sensitivity C, reactive protein, 2 forms of blood fat, and 1 type of protein were tested in the study, which involved almost 30,000 women with an average age of 55. Knowing all 3 predicted risks, not just at 5 or 10 years, but at 20 and 30 years, gives us a roadmap for how to target specific therapies for the individual patient rather than an overly simple one-size-fits-all approach, he stated. When inflammation occurs in the body, the liver produces a molecule called C-reactive protein CRP, which rises. It is a truism of medicine that doctors will not treat what they do not measure. It's astonishing. The researcher added, because a single combo blood test may predict danger 30 years later, it tells us how much silent risk we simply are unaware of and gives us an opportunity to start preventive efforts far earlier in life, he stated. The study's author, Dr. Mark Siegel, a clinical professor of medicine at New Wollongong Medical Center and senior medical commentator for Fox News, called it a big step forward in the use of blood tests in combination to assess a woman's cardiac risk. This is a substantial, compelling study that combines 3 previously unresearched predictive blood tests. I appreciate you seeing the video for today. We hope this information was helpful to you. If so, kindly like, comment, and subscribe to our channel in order to receive more advice and insights about health. Please leave a comment below if you have any queries or suggestions for topics we should discuss. I'll see you later. Keep up your heart health.